You lie in a medieval bed, weak, feverish, barely able to move, and then the doctor arrives. He doesn't bring medicine, he brings a blade. Within minutes, he's preparing to cut you, drain your blood, or attach leeches to your skin. He believes this will save your life. But what if it doesn't? What if the treatment is more dangerous than the illness itself? Before we find out, tell me where you're watching from, and if you'd trust this doctor, like and subscribe. Now, don't move. To understand why a medieval doctor might cut you open to heal you, you have to step into a system that, at the time, made perfect sense. Medieval medicine in Europe was largely built on the ancient Greek theory of the four humors, developed by Hippocrates and later expanded by Galen. According to this model, the human body contained four essential fluids: blood, phlegm, yellow bile, and black bile. Health depended on keeping these humors in balance. If one humor became dominant, too much blood, too much bile, illness followed. By the 13th and 14th centuries, this idea was not just a theory. It was the foundation of medical education across Europe, taught in universities like Salerno and Paris. Physicians believed they could diagnose illness by identifying which humor was out of balance, and then applying treatments to restore equilibrium. Everything connected to this system. Your diet, your personality, even the seasons of the year were believed to influence your humoral balance. For example, summer was associated with heat and dryness, potentially increasing yellow bile. Winter was cold and wet, linked to phlegm. So when you developed a fever, it wasn't seen as an infection. It was seen as excess heat in the body. And if heat came from blood, then the solution seemed obvious. Remove it. This wasn't random. It was structured, logical, even precise according to their understanding. But the problem was not in their reasoning. It was in what they couldn't see, because while they believed they were correcting imbalance, they were often weakening the body's only chance to survive. Before any treatment began, a medieval physician had to answer a crucial question. What is wrong with you? But without microscopes, without knowledge of bacteria or viruses, diagnosis relied entirely on what could be observed with the naked eye. One of the most common methods was uroscopy, the examination of urine. Doctors would hold a glass flask up to the light, studying its color, clarity, and even sediment. Manuals from the 14th century described dozens of possible shades, each linked to a different imbalance of humors. They also observed your pulse, your skin, your breathing. But these signs didn't reveal the true cause. A fever caused by infection, poisoning, or internal disease might look the same. So different illnesses were often treated in similar ways. Astrology also played a role. Medical charts aligned treatments with planetary positions based on the belief that the human body was connected to the cosmos. Certain procedures were avoided on specific days, not because of evidence, but because of celestial influence. In some cases, doctors got things partially right. They recognized patterns. They saw that certain symptoms appeared together, but they couldn't identify the mechanism behind them. They were looking at shadows on a wall, trying to guess the shape of something they could not see. And once a diagnosis was made, even if it was wrong, the treatment followed. And that's where things became truly dangerous. If a medieval doctor believed your illness came from an excess of blood, the solution was immediate and direct. Remove the blood. This practice, known as bloodletting, was one of the most common medical treatments from antiquity through the Middle Ages and even into the early modern period. There were two main methods. Records from medieval medical texts show that bloodletting was prescribed for a wide range of conditions: fevers, headaches, infections, even mental disturbances. Timing mattered. Physicians sometimes consulted astrological charts to determine the right moment to perform the procedure. But from a modern perspective, the risks are clear. Removing blood from an already weakened patient reduces oxygen delivery, lowers blood pressure, and weakens the immune response. In severe cases, it can lead to shock or death. And yet, to the medieval doctor, improvement sometimes appeared to follow. Why? Because some illnesses resolve on their own. If a patient survived, the treatment was credited. If they died, the illness was blamed. This created a cycle of reinforcement. The method continued, the belief deepened, and the patient, already fragile, was often left with less strength than before the treatment began. But bloodletting was only one part of the story, because when cutting didn't work, they turned to other methods, some gentler, some just as uncertain. Not all medieval treatments involved blades or blood. Many relied on herbal medicine, a tradition passed down through generations and influenced by classical texts and local knowledge. Plants like willow bark, which contains compounds similar to aspirin, garlic, and sage were commonly used. Some of these remedies had real, measurable effects. Others did not, but dosage was inconsistent. Preparation varied, and without controlled study, results were unpredictable. Alongside herbal treatments were mixtures and compounds that ranged from ineffective to dangerous. Mercury, for example, was used in treating certain conditions, despite its toxicity. Then there were the spiritual elements. Illness was often seen not just as a physical imbalance, but as a moral or divine issue. People prayed, confessed sins, and made pilgrimages. Relics of saints were believed to have healing powers. In times of widespread disease, entire communities would gather for processions, seeking divine intervention. Ironically, these gatherings could increase the spread of illness. So while some treatments offered comfort, others introduced new risks. Patients might feel temporary relief, but the underlying cause, whether infection, parasite, or toxin, remained. The body was fighting a battle it didn't fully understand. And the treatments, instead of supporting it, sometimes made that fight harder. But for some, the consequences were even more severe, because not everyone had the same chance to survive. In the medieval world, the youngest members of society faced the greatest risk. Estimates suggest that between 30% and 50% of children died before the age of 5. The reasons were many: infection, malnutrition, poor sanitation, and the absence of effective medical care. A simple illness, a fever, a cough, a stomach infection could become fatal within days. Parents understood this reality. Families often had multiple children, not just by choice, but by necessity, knowing that not all would survive. Medical treatment for children followed the same principles as for adults, adjusted for size, but not for effectiveness. Bloodletting, herbal remedies, and spiritual practices were all applied. But children's bodies were more fragile, less able to recover, more vulnerable to both disease and treatment. In this environment, survival was not guaranteed. It was uncertain, unpredictable, and often beyond control. And yet, life continued. People adapted. They hoped. They trusted the systems available to them, even when those systems failed, because there was no alternative, no second option, only what they knew and what they believed. Looking back, it's easy to see the flaws in medieval medicine, the lack of scientific understanding, the ineffective treatments, the risks that often outweighed the benefits. But for those living at the time, this system was not irrational. It was the best explanation they had. It gave structure to uncertainty. It offered action in the face of fear. And sometimes that was enough to keep going. Because when you're sick and you don't know why, doing something, even if it's wrong, can feel better than doing nothing. So now, imagine yourself back in that bed. It's the year 1300. You're weak, feverish, waiting. The doctor stands beside you, preparing his tools. He believes he can help you, but you know what comes next. Would you trust him? Or would you refuse the only treatment available? Let me know in the comments. And if you want to explore more realities like this, where survival depended on belief as much as knowledge, don't forget to like, subscribe, and stay with me for the next story.